on the cloud. Okay. All right. Well, welcome to our stroke prevention and awareness program this afternoon. We have two experts in this field. They are going to share their knowledge with us and help us be better prepared to identify the symptoms of stroke and what to do when we notice those symptoms on someone that we love or on ourselves even. So first we have Mindy Hoopengarner. She has been a nurse for 16 years. She's been everywhere in the hospital system. She's been at long-term care, home health, wound care, ambulatory care and rehabilitation, occupational health, and now she serves our community in the community health sector. So she's watching out for everybody's health here in the Tuscarawas Valley. And Christine Harrington is a registered nurse at the Cleveland Clinic Union Hospital, and she has in the ICU and education department for 35 years. And currently she is the stroke coordinator for the hospital system. So I welcome both of you ladies, and I'm looking forward to the information because it's always so vital to know in a situation with an emergency, how do you handle those emergencies? Other people are counting on us as members of a community, a larger community. So it's always helpful to know what the symptoms are when a person is having a stroke and what to do when that happens. So ladies, take it away. You can share your screen and it's all yours.
Thank you, Cheryl.
Absolutely. Thank you so much for that introduction, Cheryl. Today, we're going to talk about stroke care and how prevention is so important. We're going to learn about stroke risks and signs of stroke and be fast. So after today's program, you'll be able to identify risk factors for stroke and differentiate between modifiable and non-modifiable risk factors. Learning the key to stroke care is preventing stroke in the first place, understanding prevention, understanding and that prevention strategies begin with your own personal risk identification and recognizing signs and symptoms of stroke, using the acronym Be Fast and what to do, and also talk about some resources in your community to help you with that. And this next slide, I would like to pass on to Christine.
What do you think of when you hear the word stroke? First thing that usually comes to mind is often we think of a vessel bursting. And in this image, you see a vessel can burst, and that is a type of stroke, but only 13% of strokes are what we consider this hemorrhagic. On the left is what we consider an ischemic stroke, one that has a clot blocking blood flow. So you can think of a stroke like a brain attack, similar to a heart attack. Blood flow to the brain is interrupted by a clot or bleeding. When that happens, your brain cells and tissue are deprived oxygen and nutrients, and brain starts to die. And in fact, your neurons will die in a matter of 3 minutes without oxygen or the glucose and nutrients they need. Let's take a closer look at these strokes. Here in this image I've pulled up is the clot type of one, which is 87% of strokes. Beyond that, those cells are going to die. And you can see how the cells around that are potentially can be salvaged with that collateral circulation and early recognition. We're going to talk more about that. The other type, the 13% or an aneurysm, this one here shows you that often happens when vessels take tight turns and curves, and that happens frequently throughout the body. And we call those berry aneurysms, and they burst. We're going to find out that the leading cause or risk for those is high blood pressure. Thanks, Mindy.
Okay, so let's talk about some facts about stroke here. So we want you to know that every 40 seconds a stroke happens, and twice as many women die from a stroke than they do from breast cancer. Stroke is the #1 cause of adult disability in the US. And starting at age 25, 1 in 4 people will experience a stroke. And then lastly, up to 80% of strokes can be prevented, which is the good news. Christine?
Yeah, let's take a closer look at what disability means. So on the left, you can see this is our brain when it's healthy. The left side helps you with speaking, reading, writing, listening, number skills, reasoning, logic. The right side of your brain helps you organize that information, gives you context, spatial orientation, face recognition, your emotions, imagination. So you can imagine when any one of those sides of your brains is deprived blood flow, then we're going to have brain injury and it impacts your daily life. This is what disability is. I'm having difficulty recognizing your face. I might be described as having a low affect. My emotions could be either erratic or really flat. Difficulty understanding spoken and written word. I can't balance my checkbook. So disability, if you answer yes to any one of these, that means I need a cane, maybe crutches. I have difficulty with activities of daily living, making out a grocery list, making food for myself, limitations related to work or housing, healthcare. So let's keep going. Disability, this is 7 million stroke survivors in the US over the age of 20. Two separate studies. At 6 months, 45% of those ischemic stroke patients were functionally dependent. And these are as young as age 20 and going upwards. At 1 year, 50% had some sort of disability. Next slide, please. As we look at individuals over the age of 65 or older, what does the long-term disability look like? There's psychological impact. 35%, that's 1 out of 3 stroke patients have depressive symptoms. Even physiologic or physical impacts. 19% have impaired communication. That's almost 1 out of 5. 1 out of 2 have paralysis on one side of their body. Inability to walk without some assistance is almost 1 out of 3. So just your takeaway here is to keep in mind 1 in 5 strokes occurs in someone under the age of 55. This is what disability means, and this is why stroke is the #1 cause of disability in the US. Next slide,
Thank you,
Mindy.
Christine.
Yeah.
So I'd like to, Christine has shared with us some national factors or facts here. So I'd like to share on more of a local level. So these are the top 5 leading types of death in our area, in our county. And as you can see here, number 4 is stroke. So nationally, it's number 5. So we're not doing so well in our county. And also, again, it is the #1 cause of disability. Furthermore, just to look a little deeper into Tuscarawas County, we've mentioned that high blood pressure is a very high, it's #1 risk factor for strokes. And in our county, 40% of our population has high blood pressure. Some other risk factors of stroke are obesity, high blood cholesterol, sedentary lifestyle, and smoking and diabetes. And you can see that those percentages are listed there. We need to make some changes to our lifestyle to change some of these risk factors. So we've looked at a national level, a local level. Now that we've done that, let's look at an individual risk factors. So we're looking here at, are you or am I at risk for stroke? So listed here on the left side of your screen are modifiable risk factors. These are things that you can change. You can manage these and do something about it. And non-modifiable is listed on the right, and these are things that you cannot change. So the top 3 risk factors are high blood pressure, chronic disease, things like diabetes and atrial fibrillation, and also high cholesterol. And I'd like to point out that those 3 risk factors were listed on the modifiable risk factors list on our last slide. So that's the good news, is that there are things that we can do about these top 3 risk factors. So again, with high blood pressure, to look a little deeper into what it does to your body, we've highlighted the word damage here on each of these areas to show you that it affects lots of areas in our body. So it damages your arteries, it damages your heart, your brain, your kidneys, and your eyes. So let's talk a little bit more about hypertension. So the effects of high blood pressure or hypertension. Blood pressure is the force of blood against the walls of your arteries. It's recorded as two numbers, the systolic and the diastolic. The systolic is the top number, which is for the time that your heart is contracting. So it's whenever your heart muscle is contracting, that's the systolic number. And the diastolic number is when your heart is at rest. And whenever your heart is filling back up with blood to pump it back out to the rest of the body. When you have high blood pressure, the blood is flowing through your arteries with too much force. This stretches them past their limit, causing small tears. Then what happens is your body kicks into an injury healing mode and repairs those tears with scar tissue. So that causes things to get hung up in that scar tissue, causing plaque buildup. And I'd like to take a look at this next slide and just to show hypertension leads to atherosclerosis, which is the hardening of the arteries. And those arteries are not as flexible and soft as they used to be due to hypertension. Christine, would you like to add anything here?
I would. I think your image is terrific, Mindy, on the effects of high blood pressure over time. In that top one with the arrow going to the right, we can see this is a very healthy artery. Blood is flowing without any interruption or impediment. In the middle one, you can see how you were talking about how high blood pressure causes injury, scarring, and traps lipids or fats underneath the lining. And you can see how it's building up over time. And you have no idea this is happening, but you can see that it is blocking or impeding blood flow, vital nutrients and oxygen, red blood cells going to your tissue. And then finally in the bottom one, we finally have complete blockage. And this happens, then suddenly we have a change. And this is what we're talking about. That could be a stroke if that's happening in a vessel in your brain. Now you've got no blood flow going to neurons, brain cells, and brain tissue, and you will see sudden change. It could be your heart, that's a heart attack. Could be your eyes, we're going to learn later what that might look like. And it's your brain, and then we've talked about healthy side of brain, left and right. So thanks, Mindy. Those are terrific to show how high blood pressure is a silent killer.
You're welcome. Thank you, Christine. So this next slide is going to go over the guidelines. According to the American Heart Association, American Stroke Association, the guidelines have changed. They've actually lowered what a normal blood pressure should look like. So you can see here in the green category, less than 120 over less than 80 is considered a normal blood pressure. And then it goes to elevated if it's 120 over 129, and high blood pressure stage 1 and high blood pressure stage 2, and then of course hypertensive crisis. High blood pressure is not something to mess around with and should be treated. There are several factors that can increase your risk for high blood pressure. Some of those things being your family history, your age, your gender. Those are all non-modifiable risk factors. Also things like your lack of physical activity, having a poor diet, obesity, sedentary lifestyle, too much alcohol. Those things can all affect your blood pressure and increase it. So uncontrolled high blood pressure can injure or kill you. It's called the silent killer. It's important to know that and understand that you most likely won't have any symptoms. You may not know that you have high blood pressure. So that's why it's important to get your blood pressure checked on a regular basis.
The only other thing I'd add, Mindy, that is if you are being treated for blood pressure with your primary care physician or nurse practitioner, you might want to have another conversation based on these new guidelines. Is my treatment effective based on these new guidelines?
Absolutely. Thank you, Christine. So let's take another look here, a closer look at your own personal risk for stroke and see what you come up with here. So I think we forgot to mention, we were going to ask you to get a paper and pencil. So I'll give you just a moment so that those viewing here today can grab that quickly. And then we'll go over this stroke risk scorecard. Okay, thank you. So if we were to fill this out, what we're going to do is we're going to look at each risk factor individually, first starting with blood pressure, and mark down where you fall in which category, either high risk, caution, or low risk. So for me, I would actually fall into the caution area for that. And then atrial fibrillation, if you have an irregular heartbeat, or you're just not sure, or you know that it's regular, you would mark that down. And then so on and so forth. So smoking, whether you're a smoker, you would be at high risk. If you're trying to quit, caution, and non-smoker. So fill each one of those out, and then at the bottom, we're going to total that up. Okay, so you can see here, what you do then is you would just add up your column. If you have, say 3 things checked in the low risk category, you would mark a 3 down here under low risk. Caution, however many boxes you have checked, you would add that up. And the high risk, you would add up how many you have checked in that column as well. And then over here on the risk scorecard, we're gonna evaluate this and kind of look and see where we fall. So for me, I actually had 3 in the caution section, and I had 5 in the low risk. So I personally want to make sure that I'm continuing to follow up with my primary care physician. One of my areas was my high blood pressure. We know that that's the #1 cause or risk of stroke. So that is something that I want to keep an eye on. So wherever you fall here, if you have 3 or more check marks in the high risk category, we would suggest that you talk with your healthcare provider immediately. Ask about stroke prevention plan and make that appointment today. As far as the next category, if you have 4 to 6 in that area and fall in the caution area, you do have several risk factors, and we would want you to take control now, to make changes in your lifestyle. Follow up with your doctor, have that discussion with your primary care physician to see if there's anything that you need to do to make changes now. So again, down here below that, we kind of talk about, what to do, working with your healthcare provider. If you have heart palpitations, that might be something that you kind of notice, that you can feel that and it feels strange. That's something that you want to get checked out, because that could mean that you have atrial fibrillation, which is also a pretty strong risk factor for stroke. If you're a smoker, or if you even vape, some people think that that is safe, and it is not safe. So those are things that you would want to talk to your doctor about to stop. Knowing your cholesterol numbers. I'm going to talk a little bit more in depth about these things, but just wanted to kind of cover that there for you as well. So now that you have a better handle on your own personal risk factors, this can help you with conversations with your primary care physician the next time that you have an appointment. Christine, would you like to take this one?
Yeah, so now that you've identified personal risk, let's mitigate that risk. We've talked about talking with your primary care provider, nurse practitioner. So mitigating risk is with prevention. On the left side, we see annually the incidence of ischemic strokes, and the TIA stands for transient ischemic attacks. So you can see in the United States, there is 690,000 ischemic strokes. Remember, that's the type where there's a clot or something blocking blood flow. That other small sliver, 185,000, those are recurrent strokes. Once you've had a stroke, you're at risk for another stroke. So prevention is even more important, as important as us preventing the first stroke to begin with. That other small circle, 240,000 people annually in the US have what we call a TIA. Used to be called a mini stroke. There's nothing mini about this. This is a wake-up call, a warning sign. This is a transient ischemic attack. That means for a intermittent period of time, you had lack of blood flow to vital parts of your brain and tissue, which means time for prevention. So that's what those pillars of prevention are highlighting there, starting with blood pressure control, diet, physical activity, and smoking cessation. Mindy, you're going to go into further about this prevention. So thank you.
Yes, absolutely. So on this next slide, we're going to talk about prevention and how that is the solution to your treatment. Although we want you to know, if you have symptoms, you would want to be treated quickly, but we want you to prevent it before it even happens. So as we said before, blood pressure being #1 risk factor, we're going to talk about how to lower your blood pressure. And the first thing there listed we're going to review is eating a low salt or heart healthy diet. So some things that you can do is to not add salt to your diet, using seasonings rather than adding salt. Use things like herbs and spices. Also checking your labels, check your food labels and compare sodium content in your labels and pick the items with lower sodium content. Of course, you can buy canned foods with low sodium or reduced sodium or no sodium. Look for items that have no sauces added. A lot of times those sauces have extra sodium in them. And avoiding processed foods. So boxed foods or prepackaged foods, the frozen meals, things like that tend to have higher sodium content. That is one way to eat a healthier diet and reduce your blood pressure. Also cooking at home, you can control how much sodium you're putting in your food. And then also looking at the fats, different fats. So you want to avoid things that have saturated fats in them. One thing to think about so that you can know the difference, a saturated fat typically is solid at room temperature. You want to eat more things that have monounsaturated fats or polyunsaturated fats. And again, look at your food labels and know that sometimes packaging can be tricky. On the front side of something, it might read that it's heart healthy, but you really want to dive a little bit deeper and look at the actual content on your food label on the back. So cut back on saturated fats by replacing those types of foods like butter and whole milk and cheeses and baked goods with things that are higher in unsaturated fats. These would be things found in plant foods, fish, vegetable oils, especially olive oil, peanuts, avocado, and salmon. A good resource for this information is myplate.gov that you can reach out, you can check that out and get a lot of really good information to follow for your diet. The next thing here on this little circle picture is maintaining a healthy weight. So you want to get a healthy BMI or body mass index. Even 5 to 10 pounds of weight loss can improve your health. So a BMI, you can just Google a BMI calculator and put in your height and weight and your gender, and it will give you a number. And that number should be 25 to 29 is a healthy weight. You can actually be underweight, and that's not healthy either. So you want to try to get yourself to a healthy weight. And that BMI is just kind of a tool that we use to kind of see where people fall. There are things you can do to help with your weight as far as tracking calories on an app, or also talk to your doctor if you have concerns. Talk to a dietitian, and your doctor can actually make an appointment for you with a dietitian. It's usually covered by your insurance. The next item here is avoiding excessive alcohol use. So how much is too much? We want to kind of discuss that a little bit. So for men, it's recommended that 2 drinks or less per day, and for women, 1 drink or less per day. Next, here we have managing stress. So they have a little picture here of somebody doing yoga, and that does help a lot of people with stress levels. So that is something that you can do. Reading a book, talking to a friend to just kind of vent. Sometimes just getting things off your chest really helps. Going for a walk. Exercise can be a stress reducer for a lot of people. And then also organizing or meal planning. That's one of my areas that I stress out about. And so if I find that if I meal plan, it really helps take that stress off of me later in the week. Additionally, it's very important to know that sleep is important to our stress, and we need to be getting, as adults, at least 7 hours per night. Next on this circle here is quitting smoking. We all know that smoking is not good for our health. So this is something we need to, if you are a smoker, then that is something you need to do, is check into, how do I quit? Make a plan and figure out how you're going to make that happen. You can use the 1-800-QUIT-NOW number, or talk to your doctor, and they may be able to help you with some resources. Also, just know that Community Health and Wellness at the hospital here is working on a smoking cessation program, and hopefully to come out here in the next few months, we'll be offering that to our community. Lastly, we have exercise. And I was just curious if anyone knows, and you can come off mute to answer if you know this information, how much exercise is the correct amount that we should be getting per day? If anyone would like to add that information. And if you're not sure, that's okay too.
I'm going to guess 30 minutes a day.
Awesome. That is a very good guess because you're right on. So,
okay.
Yeah. So 30 minutes a day, 5 days a week is what's recommended. And then the other 2 days a week, you should be doing strength training exercises. So this is kind of what's just recommended for heart health and exercise. And we always do say that you should talk to your doctor before starting an exercise program. Also, Christine and I were talking earlier, and she had brought up that you want to exercise hard enough to make yourself sweat. And I always like to say too that that 30 minutes a day, 5 days a week adds up to about 2.5 hours, which is about the amount of time it takes to watch a movie. And I love that analogy because, you know, how many times do we sit on the couch and watch a movie? And so when you put that into perspective, you know, it's really important to know that this is something you do have time to do. So next, we're going to talk a little more about your numbers and managing your cholesterol levels. So to know your numbers, I have listed here some things. So first of all, blood pressure, and we've already touched a little bit on this before, that what the target number we're looking for is less than 120/80. Your total cholesterol should be less than 200. And I'm going to give you a little bit more information about cholesterol, because your total cholesterol is comprised of 3 different other types of cholesterol in your blood. First is the LDL, which is your low density lipoprotein, which is your bad cholesterol. This type of cholesterol contributes to fatty buildup in the arteries, which narrows the arteries, increasing risk for heart attack and stroke. You can think of it as LDL, lousy, or low. Keep them low. You want those numbers low, less than 100. Your HDL is your good cholesterol. And you can, what we want you to know about the high density lipoprotein is this number is one that you want to be higher. The way to do that is through exercise, by the way. So your HDL cholesterol helps protect you against a heart attack and stroke. It carries the bad cholesterol out of the bloodstream back to the liver to be processed. And remember that our liver makes cholesterol, and it actually makes all that the body needs. So this extra cholesterol that we're getting through our diet, you know, is not good for us. So that's why we need to be on a lower cholesterol diet. And you can remember HDL as healthy, happy, and high, because you want that number to be high. For women, that number should be 50 or above. And for men, it should be 40 or above. And then triglycerides, this is the most common type of fat in the body, and it stores excess energy from the diet. and this number should be less than 150. Sugars, those pastries, things like that will actually increase this number, as well as alcohol. So having a high cholesterol level, a high LDL level, and a low HDL level contribute to higher risk for stroke and cardiovascular disease. So next, we're going to talk a little bit about a hemoglobin A1C test. So just to explain what that is, it is a 2 to 3 month snapshot of your glucose levels over that period of time. It's typically used as a tool for diabetics to make sure that they are managing their diabetes and on the right plan. It can be used as a diagnostic tool as well. A physician may want to know what your baseline is. So that is something that you should also know. Next is a BMI, which is your body mass index, and we talked about that briefly, less than 25 to 29. And then lastly, it's not listed on here, but I'd like to talk a little bit about waistline. And so for women, less than 35 inches, and for men, less than 40 inches. This contributes to higher risk because it is that visceral fat that we carry in our midsection that puts us at higher risk for stroke and cardiovascular disease as well. It's important to have regular checkups, talk with your healthcare provider, and they then can review your overall picture of your health and discuss anything with you that is necessary to get you to these healthy numbers that we're looking for. And then next, we're going to talk about recognition and how that is key to review some signs to watch for on the next slide here. We're going to take a look at that. So recognition is critical. Warning signs of stroke are sudden weakness or paralysis or even tingling, numbness, sudden loss of speech or slurred speech, sudden loss of vision or blurred vision, or really any changes in your vision, sudden dizziness, and sudden severe headache, often with neck stiffness and vomiting. So the key here is sudden, and that's something that you want to keep in mind. Any sudden changes or any of these symptoms that are sudden, you want to be evaluated. So again, recognition is key to treatment and deficit. There is a time frame of 4 hours once you notice or recognize any of these, where you need to get to a critical care facility, emergency department to be treated for stroke, and it helps with those long-term effects that you may have from stroke. So in this slide, we want to show you the acronym BFAST. Previously, it used to be Act Fast and just highlighted the FAST, face, arms, speech, and time. But since they have added BE to that, because we recognize we were missing a couple areas of the brain in the back part of your brain that affects these things, such as balance and your vision. So that's why BFAST has been added, or B has been added to FAST. So now we're going to talk about each of those individually. So first, the B is for balance. So using this acronym, this can help you recognize any of these signs and symptoms. If you notice this in yourself or someone else, this is some of the signs that helps you remember what to look for. So sudden loss of balance, dizziness, or loss of coordination. The E stands for eyes. And in this first picture, you can see here on the sides of this picture, it's dark on each side. So this is a disruption in the visual fields on the left and right. It can also be affected on the upper and lower fields as well. The next picture is going to show you a picture that is blurred. So blurry vision, if you notice that. And then the last picture is a picture of a just a blind spot in the center. It can be in one eye or both eyes. This happens due to a lack of perfusion or blood flow to the retinal artery. And the longer you wait, the more deficit that you may have long term. So it needs to be treated. Many times people seek out to their eye doctor whenever they notice these changes. But if it's sudden and you're having these changes, you want to seek care through calling 911 or get to an emergency room as quickly as possible, because it could be a stroke. And then long-term, 65% of stroke survivors may have vision problems. So there's not usually full recovery, but there can be some recovery from this issue here. Next is the F for face. So does one side of the face droop? You can ask the person to smile. Another indicator would be that just that their muscles in their mouth are not working properly. They may not be able to close their mouth all the way. It may not be as easy to recognize as this lady here in the picture, but just if they're having problems with their muscles of their mouth, and the sudden changes of something like this need to be evaluated.
I was going to add, Mindy, that
Yes, please.
face, as you indicated, it could be more subtle than a droop. It could be something as simple as the coffee or milk's leaking out of your mouth. Again, the muscles are not working properly for you to close your lips.
Yes, absolutely. Thank you so much. And so next we're going to talk about arms. And this as well can be subtle. Your arm can be weak or numb. So you want to ask the person to hold both arms out. And if one of them drifts downward, that would be a sign to watch for as well. In this slide, we're going to talk about speech for the S. So speech is slurred or jumbled. It may sound like gibberish and doesn't make much sense. You can ask the person to repeat a simple statement like the sky is blue. If they're unable to repeat that, that again is something to watch for. And lastly, we want to talk about time and how time is important, because time is tissue. So if you notice any of these signs, you want to call 911 as soon as possible, and also make note of what time it is. That's very important and critical to the care this person is going to receive once they arrive at their facility. Christine?
Absolutely, Mindy. Time is critical. Every minute counts for your brain tissue. On the left, you can see that if you wait 1 minute, 1.9 million neurons could potentially be lost. If we wait an hour to seek help, 120 million neurons potentially are going to die. And the bottom part of that says, how much is my brain aged? So in 1 hour, you have biologically aged 3.6 years. You still may be 55 years old, but your brain just aged to 58, almost 59 years old, because those cells have died and you're going to lose function. So this is the whole goal of stroke centers. If you're having a stroke, recognize the signs and symptoms, call 911 and get there as quickly as possible. Because what we're racing against time for is, as you can see in this slide, is that what they call a penumbra. That is the area of cells that are potentially salvageable, that we may be able to give you medication to help open or break up that clot and restore blood flow with oxygen and nutrients to those brain cells so that you have less disability. Time is truly brain, and I can't stress enough that that's why we want you to call 911. And they're going to want to know, like Mindy had said, when was the last time you were at your baseline, when you were well? Because we have a 4-hour window to try and help. This slide is showing you that we need to get the message out to our community. We already know that those of us that live in Tuscarawas County are at higher risk for stroke than the national numbers. This is a slide from 2019, January 2019. And this tells me how early people are coming to the emergency department for care. Remember, we have a 4-hour window where that arrow is. And let's look, maybe 12% of the people are coming within 31 minutes to 50 minutes, but the vast majority are coming, less than 10% are coming to the emergency department with their signs of stroke within 4 hours. After this 4-hour mark, we can't do anything else for them. and the size of the stroke is going to get larger because those potentially salvageable cells are going to die. And then sadly, you can see the last column, Mindy, with your mouse, is that this is greater than 1 day. The majority of our patients are presenting with a stroke greater than 1 day, well outside of the window for us to try and help them. So if nothing else, if you, a loved one or a friend, is having signs of a stroke, please call 911 and get to a stroke center. We only have 4 hours to try and help you once you get to that point.
Thank you.
Yep.
So here, we would like to point out that Cleveland Clinic Union Hospital is a primary stroke center. There are certain things and certain criteria that we had to meet to become a primary stroke center. And we want you to know this so that you don't drive past us. That's the key thing here. We are an acute stroke team that is available 24/7. We have a neurologist that is accessible 24/7 via in-person or telemedicine.
Correct.
We do have designated stroke beds, sufficient diagnostic services, ability to provide that treatment that Christine was discussing within that 4-hour period of the IV thrombolytics, and tracking, monitoring, and reporting of the performance. So this slide here just shows a picture here that we are certified through the Joint Commission. And then also this picture of the telemedicine, just to kind of give you an idea there that that is what we use in the case if we need to contact Cleveland Clinic main campus. There's a neurologist who will be right there, can see the patient and help give orders. Christine, I didn't know if you wanted to add a little bit more about that.
Absolutely. The neurologists are partnering with us in the care of the patient. They're a consult with our emergency room physicians and the nurses at the bedside. And it is an invaluable resource to be able to connect our community with a neurologist 24/7, partnering with the patient and for your health and with our ER team. So really fortunate to have that.
Yes, we are. Thank you.
Mm-hmm.
So in this next slide, we just want to talk a little bit about, as I mentioned, I'm with Community Health and Wellness, and we do offer screenings for all of the things that we talked about that are preventative care to help you prevent a stroke. So we do offer free blood pressures and fasting blood sugars, as well as low-cost lipid panels or cholesterol checks and hemoglobin A1C for diabetic management in our area. You can find those screenings that are offered throughout the community on the Cleveland Clinic Union Hospital website under News and Events tab, or you can call that number listed there. And I'll give you just a second to write that down, 330-602-0779 to schedule an appointment. At that number, you can also get the information. If you're unable to access through the internet, you can just call that number to find out when the next screenings are available for you. And lastly, we'd just like to know if there are any questions today.
Okay, so now I'm going to unmute myself. If somebody's there that wants to ask a question, you can also unmute yourself, or you can type your question into the chat box, and I will see and let the ladies know what your question is.
Thank you, Cheryl.
You're welcome. One of the things that I learned, I mean, I think I know quite a bit about things, but one of the things I learned is, like people have problems and they wait to see if those problems disappear, and time is brain. Because if you wait too long, then they can't help you. So even, I know people don't want to go to the hospital, but, if you're having those symptoms and you know what those symptoms are, it's better to be safe than sorry.
I couldn't agree with you more, Cheryl. I can't tell you how many times somebody will come in, they're outside the 4-hour window, and they'll tell us, I noticed this, I couldn't hold up my coffee cup anymore, And I thought, I'll just go lay down and take a nap, see if it goes away. They wake up 3 hours later, and now it's worse, of course. Now they can't lift their arm, and there's nothing we can do as far as giving them medication to help break up the clot. So that we just need all help spreading the word that to be fast. If you recognize it, please call 911 and get seen.
Right.
Yeah, like you said, I'd rather be safe than sorry.
Right. The other thing I think is important is that I know people like well, I don't want to get into too many details, but I know people don't want to call 911. They don't want their neighbors to see that they're having a problem, or they don't want to bother anybody, you know. But truly, unless you live right around the block from the hospital, your best bet of getting in there on time is to call 911, because they can already start assessing you while you're in the ambulance.
You know, absolutely. And the benefit of calling 911, because then the ambulance calls the emergency department. They give us an absolutely early heads up. They're like, hey, we're coming in with someone who looks like a stroke. They're having stroke symptoms. This is when they were last well. And then as soon as they hang up and they give us an ETA, we're calling the CAT scanner, because the first diagnostic we need is a CAT scan of their brain. We need to decide, is this a hemorrhage stroke, or is there no blood in the brain? If there's no blood, that means that they are potentially a candidate for a thrombolytic or medication. So having the ambulance bring you, they call, we get the table cleared, and you go directly from the squad to CAT scan. Our ER physician will meet you and say, yep, patient stable, go to the CT. We don't waste any time before that CT. All those things are important. Our goal is to give you drug from the time you present within 30 minutes. That means we've got the CAT scan done, we've talked to the neurologist, we've got your IV access, we've checked your glucose, we're ready to give you drug if you're a potential candidate. We can't even do those things if you're driving yourself there. I get it, why people might want to avoid the ambulance, but this is a time where it's better to call. And as we pointed out in the presentation, long-term disability is long-term disability. It doesn't go away, and you can live with your neighbors wondering what the heck's going on as long as your brain's functioning. Honestly.
That's right. That is correct. Yeah.
I
Well,
think a
it's
lot of
just
people-
so, go ahead.
I was just going to say, I think a lot of people also, the first thing that comes to their mind is they think about the bill. I don't know if
Yes.
you know what I mean? And they think, you know, I know what comes with calling 911 or going to the emergency department. And so many people, you know, they don't want to think about having those high medical bills, but it is so important. This is a time that we cannot think about that, because in the long run, like she was saying, like Christine was saying, that long-term disability is going to cost way more than if you were to get treated upfront.
Exactly, Mindy, because now you're going to have lost productivity. And again, a stroke happens every 40 seconds. 1 in 4 people after the age of 25 can have a stroke. That is a long time. That is decades of lost productivity, of earning potential. So yes, it may be expensive, but the hospital will work with you, and
Right.
the ambulance
Absolutely.
company will work with you. I can't stress enough, your healthcare depends on your zip code. And within this zip code, we have 911 service, and we have a certified stroke center. All good resources. And we do want to partner with you in your best help possible.
Any other questions or comments from people who are listening? Well, it's been very informative. Oh,
Thank you
that's-
so much for the opportunity. Thank you, Mindy.
Yes.
Thank you, Cheryl.
Yes.
And the Dover
Yes.
Public Library. Thank you.
You're
Yes.
welcome. And we've been recording this program, so I'm going to post it in the archives. You can go to the Dover Library website and you'll see program archives. and it'll be up there for a month. And if you don't happen to see it at that time, within that time frame, you can always contact the library. They'll contact me because I have access to that file, to the recording, you know, as long as I want to. So I'm very happy if somewhere down the line you know someone who would like to know more about this. That's why the library does these programs, so that we can help our community be safer and be more healthy. So, all right. Is that it then, ladies?
Yes, thank you so much for having us, Cheryl.
Thank you, Mindy, and thank you, Christine, for sharing all of this with us. There was not a slide that I didn't write something down that I thought, oh, I would like to remember that. And I'd like to be able to share that with other people, because it might not be you, but it might be a family member. It might be your neighbor, and you could be the person that could help prevent them from getting in, you know, having this disability that's caused by stroke. So very, very important information to know. So thank you very much. And thank you to our Cleveland Clinic Union Hospital for giving you guys the opportunity to share with us.
Thank you.
Thank you so much. All right.